Aripiprazole is indeed an antipsychotic medication that is used to treat various mental health conditions, including schizophrenia, bipolar disorder, and major depressive disorder, as an adjunct treatment. Usage: schizophrenia. Aripiprazole is prescribed to manage symptoms such as hallucinations, delusions, disorganized thinking, and lack of motivation or interest. Bipolar disorder. It can be used in the treatment of manic or mixed episodes, as well as in the prevention of new manic episodes. Major depressive disorder, adjunct treatment. Aripiprazole may be added to an antidepressant medication when the initial treatment is not adequately effective on its own. Mechanism of action. Aripiprazole works by modulating the activity of certain neurotransmitters in the brain, particularly dopamine and serotonin. It acts as a partial agonist at dopamine D2 and serotonin 5-HT1 receptors, and as an antagonist at serotonin 5-HT2A receptors. Side effects: common side effects. These may include headache, nausea, vomiting, constipation, dizziness, insomnia, and restlessness. Monitoring and precautions. Regular monitoring by a healthcare provider is essential during treatment with aripiprazole to assess for any adverse effects and to adjust the dosage as needed. Patients should be cautioned against abruptly discontinuing the medication, as withdrawal symptoms may occur. Dosage. The dosage of aripiprazole can vary depending on the specific mental health condition being treated, as well as individual factors such as age, weight, and medical history. It is typically taken orally in the form of tablets or as an oral solution. There are also extended-release injectable formulations available for some indications. Special populations. Elderly patients may be more sensitive to the effects of aripiprazole and may require lower doses. Pediatric patients may be prescribed aripiprazole for certain conditions, but dosing and safety considerations may differ from those in adults. Pregnancy and lactation. The use of aripiprazole during pregnancy should be carefully considered, weighing the potential benefits against the potential risks to the fetus. Aripiprazole may pass into breast milk, so breastfeeding while taking this medication should be discussed with a healthcare provider. Long-term use. Aripiprazole is often prescribed for long-term maintenance treatment to help manage chronic mental health conditions. Regular follow-up appointments with a healthcare provider are important to monitor the effectiveness of treatment, assess for any changes in symptoms, and adjust the medication regimen as needed. Combination therapy. In some cases, aripiprazole may be used in combination with other medications, such as mood stabilizers or antidepressants, to optimize treatment outcomes. Combining medications should be done under the supervision of a healthcare provider. Patient education. Patients and their caregivers should receive thorough education about the medication, including how to take it, potential side effects to watch for, and what to do if they occur. It's important for patients to adhere to their prescribed treatment regimen and communicate openly with their healthcare provider. Duration of treatment. The duration of treatment with aripiprazole can vary depending on the individual's response to the medication and the nature of their mental health condition. Some individuals may require long-term maintenance treatment, while others may use it for shorter periods during acute episodes. Withdrawal and discontinuation. Abruptly stopping aripiprazole can lead to withdrawal symptoms, including nausea, vomiting, dizziness, insomnia, and agitation. It's important to gradually taper off the medication under the guidance of a healthcare provider. Monitoring for adverse effects. Patients should be monitored regularly for any signs of adverse effects or changes in symptoms while taking aripiprazole. Healthcare providers may conduct periodic assessments to monitor for metabolic effects. Psychiatric monitoring. Aripiprazole may be associated with the emergence of new or worsening psychiatric symptoms. Patients and caregivers should be vigilant for any changes in mood or behavior and report them promptly to a healthcare provider. Individualized treatment approach. The choice to prescribe aripiprazole and the appropriate dosage should be based on a comprehensive assessment of the patient's medical history, current symptoms, medication tolerance, and treatment goals. Psychosocial interventions. In addition to medication, interventions such as therapy, support groups, and lifestyle modifications may be beneficial. These can help address underlying issues, improve coping skills, and enhance overall well-being. Emergency situations. In case of emergency situations such as severe agitation, aggression, or suicidal ideation, prompt medical attention should be sought. Patients, caregivers, and healthcare providers should have a plan in place for managing crises. Drug interactions. Aripiprazole may interact with other medications, potentially altering their effectiveness or increasing the risk of side effects. It's important to inform your healthcare provider about all medications you are taking. Liver function monitoring. Aripiprazole is primarily metabolized in the liver, so individuals with impaired liver function may require dosage adjustments. Liver function tests may be recommended periodically. Renal function monitoring. While aripiprazole is not extensively metabolized by the kidneys, individuals with impaired renal function may still require dosage adjustments. Renal function tests may be recommended periodically. Age considerations. Aripiprazole is approved for use in adults and adolescents aged 13 years and older for certain indications. Safety and efficacy data in children under 13 years of age are limited. Elderly population. Elderly patients may be more susceptible to certain side effects of aripiprazole, such as orthostatic hypotension and cognitive impairment. Lower starting doses and slower titration may be recommended. Driving and operating machinery. Aripiprazole may cause drowsiness, dizziness, or blurred vision, which can impair your ability to drive or operate machinery. Patients should exercise caution. Alcohol and substance use. Alcohol and certain substances may interact with aripiprazole, potentially increasing the risk of side effects or reducing the effectiveness of the medication. It's important to avoid alcohol and illicit substances. Conclusion. Aripiprazole is a valuable medication in the treatment of schizophrenia, bipolar disorder, and major depressive disorder. While it can be effective in managing symptoms, patients should be aware of the potential side effects and closely monitored by their healthcare provider to ensure safe and effective treatment.